Pull up a chair and buckle up. It's the Original Strength BodCast. Hey guys, thanks so much for tuning into the show this week. Our guest this week is Marjorie Brook. Marjorie is the inventor of the S.T.R.A.I.T method, where she teaches scar tissue release and integrated therapeutic stretching. Marjorie travels all over the world teaching her techniques to body workers, massage therapists, and physical therapists. She's an expert in scar tissue, and today we're talking about the good, the bad, and the ugly of scars. You're going to want to listen to this episode. You're going to want to take notes. This is fascinating, and you're probably going to want to send this to somebody that you care about. Anyway, guys, thanks for joining us. Hope you enjoy the show. So, Marjorie, you travel all over the world teaching about scar tissue release and stretching the body, and you developed the S.T.R.A.I.T method. But so this is probably a ridiculous question to you, but I thought scars were a healing process.
They are. They're a major healing process, and that's part of the problem. Is people really do not understand about scars. First off, other than a minor injury or lesion, every wound heals with scar tissue. Okay, it's part of the healing process. We're supposed to scar. Okay, but what people don't realize about scar tissue is that it replaces the normal tissue that's injured. We have to scar, it's there. So the first thing I want to say about scar tissue is that anybody who says that they need to break up scar tissue, get rid of scar tissue, they don't understand what scar tissue is. Okay, we're supposed to scar. It replaces tissue that has been damaged. It's only 70% to 80% as strong or as effective as normal tissue if it's at its best state. Okay, the problem that we have is because there's misunderstanding about scar tissue or just ignoring of scar tissue, just let the body heal. They don't realize all the things that scar tissue can do. Scar tissue affects every single system in our body. Every system, from not just your skin, it affects your nervous system, it can affect the organs, it affects your circulation, it affects the lymphatic, it affects the polarity, which is a big one in your body, has all of that. But the thing is that what you want to do is you let the body heal. Most of the PT across the world, they tend to jump in and try to prevent and break up, as they put it, scar tissue by breaking and letting it set. That's not correct. Like your typical rehab for, say, a knee replacement or a knee surgery is they're going to put the patient on their belly. They're going to take that knee and try to shove it within less than 6 weeks towards the glutes and try to force mobility. Well, all that's going to do is cause more tension and separate the scar, the healing area, because it's over that bending surface, which is then going to cause it to scar more and create more scar tissue, right? The thing is that scar tissue has the potential to spread if left on, if there's something wrong metabolically, or we do too much or too little, or we do something inappropriate towards the wounded area, the wound can reopen, and then it's got to reheal. We open, reheal. That's an issue. So then that builds up more scar. Other times, the scar isn't given a chance to heal properly, and it's creating more of a wound in a different direction, or more of a pull in a different direction for the tension, which is then causing the scar tissue to, quote unquote, spread. It's not just where you see the visible scar is not where the scar tissue and or adhesions, which are two separate things, can spread. I'll explain that in a second. Most people consider scars and adhesions the same thing, and they're similar, but they're not the same thing. So the problem is that you're supposed to let the body heal for the first 3 months when a scar is immature, when the body's healing. And mind you, the body produces scar tissue for up to 18 months past the original wound. But after 3 months, you can do more manipulation. What you want to do in the first 3 months is myofascial release, lymphatic, gentle range of motion, gentle stretching, starting to reestablish. And the lymphatic and the myofascial release are very, very important, because you want to re-guide. It's not just the muscles and tissues that are being cut, the nerves are being cut, the lymphatic vessels are being cut. And while the lymphatic vessels will regrow and heal in 2 weeks, where are they growing and where are they going? They're getting entangled in the scar tissue unless you do lymphatic and myofascial release to encourage it to go towards the nodes or the proper flow of what it needs, where it needs to go. The other thing is, so after those 3 months, as you're gently doing range of motion and you're doing myofascial release, you're doing lymphatic, after 3 months, you can get, and I'm going to quote in air quotes here, a little more aggressive. By aggressive, that's a relative term, meaning more aggressive than lymphatic, not meaning go in and tear apart. Then you want to start working the tissue and separating the tissues where it's stuck, getting it to release, and increase proper flow, give more range of motion, and work with the body. But you have to understand, it's with that too, you have to understand what the injury is doing, where the tension pulls are, what the person's metabolism is. Like if you're working with a Caucasian versus say Black or Asian, the darker your skin, the more likely you're going to keloid and scar, because it's the melanocytes that create in the skin that create the scarring. So when you get hypertrophic and keloid, is usually the darker the skin, the more likely, unless you really start messing with it from the beginning, and then you can create the hypertrophic scar on any type of skin. There's just so much involved in that people don't understand, and they don't understand how much that scar tissue is affecting the rest of their body. When I said adhesions versus scar tissue, and you made that face, everybody does that. So this is what you have to think of when you think of scar tissue. Picture a Band-Aid or a plasty, for those that are not in the US that may be listening. You look at the Band-Aid, right? And you see that little square in the center, that little cotton square. And if you look at it real close, you'll see it's a bunch of interwoven fibers, like your collagen is doing during a wound, right? And you're going to place that little piece of cotton right over the wound, correct? But is that piece of cotton going to stay there by itself, Tim? No, you need the adhesion, adhesive strip to hold it in place. Okay. So when you have inflammation in the body, whether you sprain your ankle or you've had a wound that's opened up and the body's become inflamed, that inflammation is the body's warning signal to change the ground substance into a thicker, stickier, adhesive consistency to help support the area. So the scar tissue is the collagen fibers that are coming in to rebind and heal the wounds. The adhesions are the body transforming the gel in the area, the ground substance, into a more sticky substance to support and like cement the area and hold it together while the fibers are healing. Two separate things. The reason I always stress, you still want to make sure that they're all cleared out. You don't have excessive adhesions. You don't have excessive scar tissue. But what people don't realize is that you can have adhesions from without a surgery, but you will never have without scar tissue, but you'll never have scar tissue without adhesions. Like you can sprain your ankle, not break anything, and you can end up with adhesions in the ankle area because there's been massive inflammation. And then if you don't treat that area, not just for getting the range of motion back from the sprain, but by releasing all the adhesions that have formed in the area once they're no longer needed, you're going to have some adhesions stuck in that area, which can then lead to more sprains or instability or more tension via the ankle, which then is going to translate up the kinetic chain to everything else. So it's like when people rehab, they don't think about the adhesions in the area. They think the body's just going to get rid of it. To go back to the Band-Aid, when your body is healed, when the wound is healed, you go and you bite the bullet and you rip the Band-Aid off, right? But does that Band-Aid always come off clean?
Hardly ever.
No, it leaves some of that adhesion stuck. And no matter how much you clean and no matter how much you scrape, that adhesion stays there for a little while, right? That adhesive, and it sticks to everything, sticks to your arm, sticks to your hair, to your shirt. So the same thing happens in the body. The body comes in and clears out everything when we no longer need any excess, but sometimes it misses it and leaves a little bit. Now we have tissues that should be slipping and sliding and moving, but we've got a little stuck here. So now we've got tissue that comes back, gets a hold of that adhesion, and all of a sudden we spread and we've got more stuck. And then we've got more stuck. Or we have the adhesion, stuck area here, and we reach for that can of peas and we rip the adhesion. Now that could be a good thing. We've separated the adhesion, or when that adhesion ripped, it took a piece of the healthy skin that it was attached to. which means what? Now the whole healing process has started again. The same thing with the healing process is that when you have a wound, we hear about the multiple stages of wound healing. But what people think about, because they hear stages, you have stage 1, stage 2, stage 3. That's not necessarily, that's how it starts in stage 1. But let's say you just had to crawl because you couldn't wait for that wound to heal. You had to get down and crawl because that's what you do. And what happened is when you were crawling, you ripped just this little bit end of the scar. So now this scar has gone back into the beginning, while maybe this part of the scar is in stage 2 or stage 3.
Okay.
Right? So now it's not all in the same stage. And maybe you healed up a little bit. You're like, oh, you did too much, you waited, but then you just had to do windshield wipers. Right? And all of a sudden, this is healing, but now you ripped over here. So now the middle's in stage 3, this is in stage 2, we're back to stage 1 over here. So this is a way that things start to pull and spread, and scars do not heal well because people don't realize that. And then the problem we have is PT and other therapists and nurses who are working with scars is they just jump on and they start pulling things apart, and they start using tools and cups and overdoing the exercising because like, oh, we have to prevent scar tissue, we have to prevent adhesions. Well, you need to control the scar tissue, and you need to keep the adhesions from spreading, and you don't have to worry about relieving it for a couple of months. That's the biggest problem with actually working with scar tissue, is that people don't, and I'm just like kind of touching the tip of the iceberg. And that's, an iceberg's a good reference as well, because when you look at an iceberg, you all know the reference with the tip is on the top and all that's on the bottom.
Mm-hmm.
That is a perfect example of scar tissue, because people just look at that little scar and they don't realize how much the tissue and the adhesions in the scar tissue has spread and how much it's affecting other areas. And we all understand tensegrity. We all understand the pull of the tension. So you could have a C-section scar, for example, and be having problems in your shoulder and your back or your ankle simply from the pull. Or one of the ones I love to talk about is let's say you've had implants or reconstruction from a mastectomy. The first question that I will always ask my clients is, do you have problems with your feet? You'll find that about 60% of the women who have reconstruction and or just implants, cosmetic surgery, will have Morton's neuroma on their feet.
Why?
Well, think about the fact that you went from, not you particularly, but someone went from like an A or B cup to a C cup.
Okay.
Now, all of that tension is pulling. And then the end result of that tension is the bottom of your feet. Not to mention, they're not given the exercise to deal with the extra weight. Or if you reverse back to the mastectomies that are the rebuild and they're having the same size, all of that scar tissue is pulling and lifting because none of that scar tissue gets treated. In fact, and so now that's pulling in this. Now you've got the pull. You can end up with the foot issue. You can end up, most mastectomy rebuilds, they're going to end up with shoulders and neck and chest issues. They're going to have range of motion problems. And depending on the rebuild that they did, if they did, this is another thing about scar tissue, just a side thing. There's at least 7 different ways to do reconstruction. Did they do implants? Did they do the deep procedure where they took from the stomach? Did they take a piece of the lats? Did they take a piece of the glutes? You need to know this before you just go. Also, understand they're taking healthy parts of a muscle to reconstruct the breast and then giving no rehab. So you've just lost a piece of, the lats are pretty important. The glute medius is pretty important, and that's being taken away and removed, and the person is not getting rehab. But at the same time, nor is a person who's having heart surgery. They get to ride on the bike and blow in the tube, but no work is done to reestablish inhalation, exhalation. No work on the intercostals. No work on opening the chest up, which is now constructing the skin and the adhesions that are, if they've had open heart where they crack the chest, where the wires are put, that the tissue and the adhesions are adhering to that. No rehab for that. So the biggest thing about scar tissue is that all the different ways it's affecting, knowing all the different ways, knowing the different surgeries, knowing from the accidents, knowing the sports that they do, the exercises that they do, because all of that abuse or life on the body is going to affect how the body is going to heal, how the tension is going to build up, where the adhesions are, because you could have the adhesions even before you had surgery from something else. All of that together, right, to reset the body back to factory settings. And understanding and honestly how the body is designed to move, which is like with the OS, is working on how the body was meant to move, right? We're trying to bring them back to factory settings. And if you don't understand all of these pieces and how to rehab and how to do that, you really should not be messing with scars. And it's crazy. It really is.
So, okay, because see, so somebody gets injured or they have a surgery,
Yes.
and then they get to go to their physical therapist for their 6 to 8 visits that their insurance allows or covers, which is well within the 3 month period for a lot of them, or somewhere the 3 to 4.
Right.
But maybe they address nothing with scar tissue and the person leaves and goes back to their life. But now the scar tissue grows, or you got your adhesions and stuff, and they're trying to go back to their normal life. What are some possible, like, how do they end up knowing they need scar tissue release, or what ends up happening to them that drive, because it sounds like a lot of issues could start popping up that they end up chasing their tail, never being close to the root of it.
Well, that's exactly the problem. I always tell my students that 60% of the injuries that come into them or the issues on the table might have been caused from something in childhood. The accident, in football accident, playing that, and that wasn't addressed all the way from there. The thing is that people suffer repeatedly. They'll tell the doctors, I still feel this, I still feel that. They're like, oh, it's in your head. And after a while, the family members stop listening because it's always the same complaint. Or you get frustration and depression, or you get adaptation, or worse, you get compensation, which then, as you know, leads to all other kinds of problems. I've had people come in for a shoulder bothering them, and I then turned around and treated a hernia scar from when they were 22, and now they're 46. And treating the hernia scar released the shoulder because it was that constant pull. Or we can do like the other thing, like with the C-section, the C-sections, people think about, oh, the psoas, maybe the pelvis is off, but they never go and check out the diaphragm. Because scar tissue, especially if you've had 2 or 3 children, you'll hear mothers say that they have more trouble breathing by the 3rd child, or by the 2nd child, they're having more and more trouble breathing because that scar tissue and that adhesion is traveling up and limiting the ability for the diaphragm to work. And no one thinks about that. Or no one thinks about the polarity, about the electromagnetic current that runs through our body is negative, right? Everybody's. Scar tissue heals positively charged. Due to the blood that comes into the area to heal, the iron, everything in it. So you have 2 issues going on, multiple issues going on. You have the healing agents, magnesium, calcium, all of that, which are also positively charged, being rejected or repelled by the positive energy. The energy in the scar is now interrupting the magnetic field of the body. It's interrupting the flow of the circulation. It's, if you're going traditional Chinese medicine, especially with like a C-section, that's right across all the meridians, right across the middle, right? And it's blocking all of that and interfering. The other thing that with scar tissue, because of this electromagnetic issue, the energy can't go anywhere. It's building, and then you end up more like with Frankenstein's lab, where you see energy like shooting in the lab. The capacitor that's holding that energy, which is what your scar is acting as, will then randomly fire because it can't contain anymore. It gets full. And then all of a sudden you're having pain all the time in your shoulder, which doesn't make any sense. No one can figure it out. Doctors can't figure it out. It could very well be that your C-section scar or your appendicitis scar is randomly giving off energy, which is being shot in a pattern and hitting your shoulder. Yeah, I know, it's going to make your brain go boom. These are all these things. When I sit there with my students, like, I can learn this work in 6 hours. No, you can maybe learn the technique and the hands-on, but everything that's behind it, because one of the big things is you don't have to work with polarity. If you're not a polarity person, I'd say you'd recommend someone out, but you would then have the answer to someone who's been in pain for 15 years and can't figure, or 10, 15 years past the C-section. Now they're all of a sudden having a shoulder issue that no one can explain. Well, my first thing is, well, where are your scars? And what's clear the scars? If clearing the scars doesn't stop the problem, then we'll go on to the next thing. But the first step in every therapy and every rehab program should be, let's take care of the scars and see how that's affecting. I've had people come in 10, 20, 80 years past having scars, from the scars being that old, and making a difference. At a Brazilian soccer player who had a sports hernia surgery, and he's in his 33. And then as I'm working on him, I go, well, what's the scar on the other side? And he goes, oh, I had a hernia when I was 4. That's no big deal. I go, actually, that's the problem. Because scar tissue is, I call it like monkey mind. It finds each other. Think of tensional poles. Okay. So if you have a tension from a scar, the body develops a specific way due to that tension. Now let's add a second tension. Tension finds tension. Scar tissue is going to spread and find each other. So that's another way that scar tissue can spread through the body. There's just multiple ways that scar tissue and adhesions affect us, and it gets no attention whatsoever. I always tell a large percentage of my practice are people who find me, they're at the end of their rope.
Yeah, I can imagine.
They've spoken to the doctors, the spouses aren't listening to them anymore. The doctors are like, it's in their head, there's nothing wrong with you. And the truth is, like, I've had weird things, like even I had someone who had a hernia meshing, and the mesh was okay. They didn't have the bad meshing, but they had this weird pain, all this. And I said, well, how did they adhere the mesh? And it turned, I've had this happen multiple times, where the prongs that they use to put the mesh in, they were, what was the problem? They were either adhered around it, or they were grabbing a piece of a nerve. So, and no one looks at that, and no one thinks about that. But that I've seen as a result, when following scar tissues, I found other issues in the body in regard to that. And the other problem is that because people are not getting proper rehab, as you know, right? They'll go to the PT, and PT will just want to strengthen right away. They don't, which is wrong. You do need to strengthen, but flexibility and range of motion has to be restored first. Right? To strengthen on top of an atrophied muscle, or something that's shortened and tightened, it doesn't make any sense. You need to strengthen as you go, but you need to regain the flexibility, the range of motion, and the mobility, and strengthen. The flexibility has to come first. And that's all being limited by the scar tissue and the adhesions, and piling more, as we know, strength training actually causes micro tears, right? If we're doing right, which is scar tissue, and you want the micro tears because it makes the muscle stronger. But unless you're in the Arnold Schwarzenegger, I want to be as big as possible group, you want the strength without the bulk. That's where the stretching and the scar tissue work comes in, because you can, if you stretch and you do range of motion and you do a little bit of massage after a proper therapy, you will get 10 times stronger without the bulk, because you'll realign those fibers. Those micro tears will realign back in with the fiber, with the fibers of the muscle. So now you've got the strength without the bulk. There's so many different areas that scar tissue affects our lives.
So it almost sounds like you literally, and you probably are, like you have to be Sherlock Holmes to be able to problem solve or unwrap the onion to get to the root of the issue.
Yeah, you start with the basics. You do. You start with the basic. You start to peel, and an onion's perfect because scar tissue is layer by layer by layer from the surface down. Many therapists, and actually all massage should be that way, and in regard to that. But many therapists are taught to grab the muscle and get down as deep into the belly of the muscle, or toward as far to the bone as they can get, which is wrong. That's not how the body works. You have to start from the outside in and work your way in, so you don't cause pain, and the body trusts you and allows you to, and says, okay, this person is here, this therapy is here to help me, not hurt me. I don't need to tighten up and defend myself against the onslaught of the therapy. That's in any therapy. You don't want that. But as you go, and again, it's not just understanding the surgeries, understanding the person, what they're going through, at what they've been through, and what they're going through at that moment, what their emotional state is that moment. Because what other people don't really realize with scar tissue is it's a huge PTSD trigger. And A lot of therapists like to say the issue is in the tissue. That is not correct. The issue is in the brain. The trigger is in the tissue. When you smell something and you have a memory, you don't say that the memory's in your nose, correct?
Right.
So with scar tissue, and anytime there's pressure or a specific movement that pulls on the tissue, it can send somebody into a PTSD or trigger memories or emotions, as well as visual. I mean, just visual for some people when they see the scar in the mirror, and then they feel the shirt or the belt the waist of the pants rubbing on it. That just alone, that light touch or that quick visual can send them back into an emotional state or a PTSD situation. And people don't realize that. I had one client that had a scar and her waistband was continually rubbing on it. And she had all kinds of emotional stuff going on all the time. And really, what it was is the emotional things that she was going through at that time got translated into this little cyst removal scar. And every time it was like pushing the button, remember me, remember what you went through. And she had a lot of, once we cleared the scar and she managed through talking to and sensory integration, she realized that, oh my goodness, it really wasn't the scar. It was just making me think of this stuff. And she had to go back and deal with what she wasn't dealing with. um and it is like a detective work but let me also stress, I'm not being a shrink or anything out of my scope of practice. I'm basically guiding and helping them to make the connection to reconnect with their bodies and understand that the emotions are there and that working on scar tissue can trigger it. And it's very much that you need to understand this if you're working with someone like a veteran who, their scars are from a war area and understanding that, or my cancer people who are also veterans. They're veterans of their war that they fought. And something as simple as understanding that tattoos are scars, right? Everybody loves tattoos now. But what's the first thing, Tim, that they do to you before you get radiation? They tattoo markers,
Yeah.
permanent tattoos. And those tattoos, that area of that skin receive the most radiation. So if you're going to work on someone and you're not aware of the fact that you're working over some area that is more sensitive than another, and because it's got most of the radiation, and on radiation was, again, detective, when most people treat with radiation, they treat the area where the radiation went in and they don't look for the area where the radiation went out. So these are, I mean, like this, yeah, see, this is the point that I try to make to people. There's a reason that I have multiple classes and I do all of this. I mean, the hands-on technique, which as with any technique can be learned and it just needs to be practiced. But putting hands on someone without understanding, you are not going to set on a rehab program with someone unless you understand where the injury came from, what they've been through, what their job is. You were a fireman. You know exactly what your body went through as a fireman, as opposed to someone who sits at a desk. So you already know some of the things that are built up, or if someone's sitting at a desk, you know what's been going on with them sitting. And you consider that as a trainer and rehabbing people with the OS. That has to be considered with all therapy, every piece of that person's life and what they're going through and what can be triggered. And the therapist himself, has to be ready for any type of emotional reaction, and how to redirect it so it's not hit on them, and where to send these patients where they need to go. And being there for the patients and knowing things. I mean, I go from before surgery to after surgery to know the questions. Like, someone's going in for surgery, the first thing I say to them is, do you understand why you're having that surgery? You would be amazed, Tim, or maybe not, how many people are going into surgery. And when I say, well, why are they doing the surgery? And they go, well, because I'm in pain. No, that's not the question. What is the specific thing that's going on with you, why they have to do this surgery? And I will tell you that 85% of the people will say, I don't know. They said, this is what I have to do to get out of pain. So they're basically handing themselves over. What most people don't know is 90% of the surgeries in this country are elective. And only 85% of the people of that 90% know that it's elective. Wow. So they don't understand the surgery. They don't understand what's going on. They don't know what to ask. They don't know what they can ask. So I start with, okay, you're having this surgery. Here's the question sheet. Go back to the doctor. These are the questions you need to answer. right? And if
Oh,
you don't know the answer to those questions, come back to me. And if I don't know the answer, I will get the answer. I also tell them to put their phone on record. So they have everything on the phone just in case. So that's the beginning. That's where my therapy may start, with someone who I know, a current patient who's going into surgery. I mean, like, would you deal with a lot of knees and hip replacements, right? With OS?
right.
Do you know if someone's going in for a hip or knee or something where metal's being put in the body? Do you know to say to your patient, you need to find out what they're putting in? And they'll say, oh, it's titanium. I go, no, you need to find out if it's pure titanium or titanium coated nickel, which is more likely what they're going to put in. And if they're going to put that in, the patient needs to be allergy tested for nickel.
Wow.
And they don't. It's supposed to be a standard thing, and the doctors just don't. They're shooting the odds that the 15% of people who are allergic to nickel is not one of their patients.
So really, everybody needs a Marjorie Brooks, a true
Well,
health advocate. I mean, because that's what you
yes.
are.
Well, every therapist should be. Okay, so if you're dealing with rehab, like you're dealing with strength and people that want to get better, but you
Mhm.
inevitably, as an OS, as a trainer, have people that are going in for surgeries or have diseases and disorders that are coming to you to help deal, because OS is like one of the best ways to recoup from all of that and prep for that, to prep for the surgeries, all with that. So you as a trainer need to know, if someone's coming to you and they've had a surgery that you've never dealt with or heard of before, you need to go and research that surgery. You need to Google on YouTube and watch a couple of the surgeries. Because if you've never seen a knee surgery, a knee replacement surgery being done, and you're working with knees, you need to see how violent that surgery is. They're literally taking a spike and a hammer, and they're slamming, and you're watching the body just like shake on the table.
Mm.
Um, so you need to understand what's going on with that. And the more you do this, and the more I ask people that many people who work with mastectomies, and I go, well, I ask that question: how many different ways are there to rehab, to reconstruct? And they're like, they can't list them all. I said, but if you don't know to ask that question, how are you going to know how to rehab and treat? Do you know to ask how many drains they had and where were the drains, and the effects that having those drains on in any surgery, if they've had a drain? It's emotionally devastating and psychologically, having drains attached to you and things coming out, or if they've had a port, which is someone who's on permanent medication for a while, like chemo, whatever, they'll put a port in, right? Just the procedure of the port, but that's also horrifying for people. For my old school people, think of Dune for a second, where anybody, you could be sleeping in the hospital and someone's going to come and pop that cap and put medicine and invade your body, right? And it's a constant invasion. And how I find things like ports and shunt scars are like the most, and drain scars are like the most emotional. And they look at these little drain scars. Oh, it's no big deal. Oh yeah, it was. You had a tube wrapped in there, and the process for removing that, if anybody's ever had a drain removed, they're just going to shudder, because it's massively painful and scary. So the more you know about the surgeries, the more that you know, or the accident and the rehab and what everybody's gone through, um, the better equipped you are to understand when you put your hands on them, or when you're trying to get them to move a certain way and you're realizing they're not moving this way. Well, maybe because that was the position that they were laid in surgery for an hour and a half, 2 hours, 3 hours, 4 hours, and you're trying to get them to move. We'll go back to mastectomy. Mastectomy spends hours like this. Then they come out and they've got shoulder issues, and people are trying to treat them and force the arms up. And really what it is the body's protecting itself from the trauma of being held out or on the cross while during the surgery. And some of them repeated surgeries. So just information like that, being well informed, which is what I tell everyone, that trainers, massage therapists, PTs have to watch the surgeries, but they don't always understand. You need to know what your patient's been through, or at least have a good idea of all the different possibilities, before you start to make that training program, or while you're in the training program and starting with your basic understanding, and you start to observe things. You have to be set to realize, oh, this is because this is what was happened during surgery, or this was the position that they laid in for 3 hours after. Because there's always an emotional component, and there's a somatic component where the body is being sent back by that motion. It's a lot. It really is. And this is one of the big things that I try to get across to people. All of this, and we're only, again, tip of the iceberg, but all of this and scar tissue is not paid attention to.
This is amazing. So I have a childish question for you,
Never childish. Go ahead.
because I have this idea that the body's made to heal.
Yes.
And you've already said that scar tissue is actually, it's a healing process.
Yes.
Is the body designed to have a natural remedy to help alleviate or resolve its own scar tissue? Like, do you understand what I'm saying?
Yeah, no, it is what it, so the body is designed, like the first thing is you never see an animal just lay down and stop moving, right?
Yes. Okay.
Okay. They don't get on the couch and say, can you hand me the Ben and Jerry's, and can you get that remote control for me? They don't do that. They move as much as possible, but they also move within, if they're wounded, they'll lift that leg up and walk on the other three for a little while and slowly put the leg down because they understand that they're injured and it's going to take time. It's instinctual. The body does heal. The body does come in to remove excessive, it'll change the body, the consistency of the ground substance and get rid of the adhesions. So, the fibroblasts that come in and create the collagen in the scar, when they're done, they go on siesta. They don't leave. They just go to sleep in that area until we do something stupid to wake them up, and then they'll repair again. So the thing is if the body's going to automatically try to fix itself, but if we don't respect what the body's been through, right? If we do nothing and just sit there like a lump, the body's going to create more adhesions because it needs motion and movement to reset its homeostasis. If we do too much movement or we do the wrong movement, because either we have to go back to work because we have no choice, we have to feed our family, or we're addicted to working out, or my runners, the runners will run on broken. I had a person who ran a marathon in a boot.
Yes, yeah, I know.
I'm like, what are you doing? If you need a boot, then you shouldn't be running.
We will save the world from this sickness one day.
Yeah. So people will do things either because they have to, or because they have to because of life's demands, or because of their obsession. And they're not trained properly because we're not raised with understanding body mechanics and proper movement, right? The parents aren't taught to, when the kid falls down and gets hurt, we're told to pick them up, clean the boo-boo, put the Band-Aid on, kiss the boo-boo, let them run. Well, no, let them go, but then you have to observe for the next day or two, something alter. Had they changed the way they're, like, someone sprains an ankle, right? And now you've got swelling, you've got adhesions. They shift their weight to the other side, and they change their gait. Eventually the ankle is hopefully better. They start to shift back, but they never shift back 100% because they've now set up this compensation, and they don't give the ankle the chance to fully rehab and put their weight back on it. They never quite trust it. The body's decided injured area. We haven't shown the body, no, recovered area can do it. You literally have to treat your body like a 3-year-old and show it and guide it. Otherwise, it's just going to always be on guarding and defensive, because its job somatically is to keep you functioning. So the body will always compensate and guard unless proper understanding of what needs to be done and how it needs to be done to reset the homeostasis. That's why when you see the 60s and the 70s and the 80s and 90-year-olds that are still doing gymnastics or doing these amazing feats of strength, it's because they've honored their body and kept working and kept moving and kept doing things correctly, hopefully. But everybody has a little something that we don't teach the kids, we don't teach the parents. I can tell you so many issues from kids, like just riding their tricycle and they did that fall forward and hit the chin on the bar.
Yeah.
And everything. Okay, so now that mandible is probably out of alignment and they're not stretched, they're not gone to therapy, they're not, maybe a little craniosacral is needed, something to reset that. And then from that age on, they're already off kilter. Adhesions and things are being done. Kids in casts. I mean, 1 out of every three kids, children has a cast. They take the cast off. They're like, oh, okay, bones are straight, go play. Now, the casts are lighter, they're fiberglass. But when you and I were kids, they were the heavy plaster of Paris. that child has completely altered their gait, how they walk, how they do, how they use their hands. Time has to be spent, maybe a day or two, couple of exercises here and there for a week to reset that child. And so the child understands how the body's supposed to work. If we did that, the body will naturally always go back to homeostasis, as opposed to the way we are now, which is, what do we have to do to keep functioning?
Right.
And living into the compensation. So it's not a childish question in the fact that the body is an amazing machine. It's designed to heal itself as much as it can and keep functioning, but its need to preserve itself and keep itself functioning is stronger than taking, is a stronger instinct. So it's going to go into compensation. It's going to go into altering itself to keep itself functioning and safe, unless from the shock of the trauma, unless we retrain it, unless we keep it and show it the right way to move. So many people have no idea that they don't walk properly or sit properly. I mean, how many times have you seen someone and said, oh, they must be in a lot of pain? But
Yeah.
to them, they're perfectly fine, because that's the level that their body has set itself to function at.
I think too, you actually, the way you describe, so when an animal gets injured, it still moves around, but it moves instinctually and intuitively around what its issue is.
Mhm.
Whereas a lot of times we're told to, hey, you need to shelf yourself for about 2 to 3 weeks. And so we don't honor our body, and we don't move instinctually, or we've lost our instincts to move.
Even if we're told there's certain things there are times when you can't move. You've got stitches, you've had abdominal surgery,
Right.
but your foot moves,
Right.
your toes move, your arms move, your head moves, so you can still do exercises. You do the eyeglasses that I told you. Your eyes move, right? How many people exercise? Oh, there's my accent. Sorry. How many people exercise? Sorry about that. How many people exercise their eyes? We've talked about this. You've done a little blog about it. You can sit in bed and put a chart up, and you can exercise your eyes, and then go down to moving your head. You can
Yep.
start moving there's always movement. I have therapists who say, why can't they just get us? There's always something that I can work on, that I can stretch, I can massage, I can do, that won't interfere with the healing process that's not supposed to be moved at the moment, which is also setting them up. And that's post-surgery. I mentioned pre-surgery. I mean, women are not prepped for giving birth. They're better now. People are not prepped for any of the surgeries that they're going into. If it's like a knee surgery, hip surgery, lose weight as much as you can. Well, how about we also pay attention to how we've been moving? And once we're in bed and we've had the surgery and we're trying to move the knee, well, don't forget to move the other leg. There's balancing exercises. You have a knee going on, you can't get up, you can do pelvic exercises and non-weight bearing exercises, and do in the rest of the body. When we're injured, we tend to focus just on that injured area and not how that injured area has affected the entire body.
Or how the entire body can affect that injured area.
Exactly. That's the whole thing. It's a cycle, the kinetic chain, everything's there. And in that chain, though, you can't ignore the mental part of it, the emotional and mental part of how that injury, this and what that person's feeling. Are they afraid of pain? Are they one of those people that they won't do anything because they're afraid of pain? Or are they the overachiever that will go through and ignore the fact that they're in pain, because no pain, no gain, which is the worst statement ever. But the body's sending you pain for a reason. It's a signal. Danger, Will Robinson. And for those of you who don't understand that, that was an old TV series. They don't listen. Or you have ones that today they might be all eager. Okay, let's work this. We'll do this. The next time they come in, they could be depressed. They could be angry. You deal with a lot of athletes. Are you dealing with where their injury is now threatening their scholarship? Is it threatening to send them from the majors down to the minors? Is it threatening their entire career? So now you have anger, you have frustration at that injured area, not just life and ever. So they're not looking at that area the right way. It's the enemy now. It's the cause of all their pain, instead of a part of their body that they should love and want to help and encourage to get better.
It's as if it's waged war against you instead of trying to help and heal you, and vice versa. You could wage war against it too.
I had a woman who she was volunteering in one of my SCAR classes, and she was young, she was like late 30s, and she ended up having to have a hip replacement. And she was all excited to tell me, she was having a lot of issues, but she was excited to tell me how she made peace with it and she said goodbye to her hip and everything else. And she's talking about this, that, and then the way she was moving, I said, well, let me ask you a question. You made peace with the fact that you had to lose the hip, but have you ever said hello to and welcomed the new hip that's now giving you the ability to continue with your life? And she looked at me totally shocked. And she's like, no, I didn't. And because she was constantly complaining about the hip and this and that, and even at the same time saying that she made peace with having to lose the actual hip. I'm like, yeah, but there's two ends to that. You know, you have to welcome a lot of women who get mastectomies and get the rebuild. They won't ever touch themselves again. They won't look at, I had one woman who wore a t-shirt even in the shower for a year
Oh man.
after the dub because she's so upset over and disassociated. You will find that 95% of all the people who have scars have never touched or make a point of not looking at or even recognizing the fact that they have the scar.
Wow.
And the thing is like there is, and take this the professional way that it's meant, there isn't any part of your body that you shouldn't be able to touch. Okay, that's a disassociation. And when you're disassociated, even with like a half inch of your body, you're
Yeah.
upsetting the whole thing. And many people, and there's other issues that come with scars. There's many people are very numb, especially women, C-sections, hysterectomy, any type of abdominal surgery. People will be numb below the scar, from the scar to the pubic bone, and they can't feel. And we can fix that in 5 minutes. That's just nerves caught in the scar tissue, but they go their whole lives with a whole area of section of their body being numb that they can't feel. And that's actually a very important area that should not be numb for multiple reasons. Um, and they don't realize it. I had one woman, and her husband was, she was coming for her C-section, was 20 years old. Her husband was fighting her about coming in and spending the money because the insurance doesn't cover it for the scar tissue. And I worked on it for her pain and for this and that, her restrictions in her shoulders and everything else. She comes back the next day and she says to me, she goes, as I'm working on her, is it possible that you working on the scar could change sex? And I go, nice orgasm. And she's like, oh my God. She goes, now my husband says he has no problem with me paying and coming to the surgery.
Of course he does.
For the therapy. But again, people don't even realize that C-section that the woman is ignoring, because it was just, and it was affecting not just her physically as far as mobility and pain, it was affecting her internally as well. And it's very, very common, but nothing's ever said about it. Also, in that regard, do you know that 6 out of 10 women who come to my office with C-sections do not consider their C-sections a surgery? It's just they
Wow.
give birth.
Right.
So if you think of it, there's a lot of reasons behind that. It's either they just gave birth, or also because emotionally they feel less of because they weren't able to have natural childbirth. There's a whole gamut of things that could be behind that thinking. But the main point of that story is that if they don't believe, they're not treating their surgery that it was a surgery, then rehab, which they don't get to begin with, they're just told to get out of bed after 2 days and take care of the baby. Now it's just completely forgotten. It was never a surgery and it was never addressed. There's just people they don't, the scars are forgotten. One of the questions on my intake form, I used to put, please list any and all surgeries. And I had to change it to have that one along with, please list any and all medical procedures. I literally had a woman say to me once that, well, she didn't have surgery. Well, they did take out my uterus, but they did it through my belly button. So that really wasn't a surgery, because they did laparoscopic.
Right.
So people think laparoscopic and orthoscopic, no big deal because they leave those little holes. And yet it is a huge deal. I mean, they removed an organ out your body. It doesn't matter if it came out your belly button or out. And people just don't regard surgeries as the way they affect the body. And they don't think twice about the scar tissue and all the different things that it can be affecting. And the surgeons, so long as you've healed and there's no infection and they didn't leave anything inside of you that they shouldn't have, the surgeons are done. And the rehabs out of surgery and injury are never what they really should be. A woman who's had mastectomies, for example, they don't even talk about lymphatic massage until lymphedema has set in. That blows my mind. They've removed nodes, all this, but here's the thing. Every single person who's going for surgery should get at least 2 lymphatic massages within 72 hours before the surgery. Like, wouldn't you want your lymphatic system cleaned out and boosted before your body is assaulted by a surgery? And then you can do it in the hospital bed or right after the surgery. You should be getting lymphatic massage and myofascial release to aid the body in healing itself and showing it how to heal, not just letting it being an abused, wounded thing that has to sit there and suck down the Ben and Jerry's and wait till they're capable of moving.
Wow.
There's just so many facets in different areas and many things that therapists and trainers can do to help that they don't even realize that they can do, because they say, oh, you're acting out of your scope of practice, but you're not. You're just making people aware and giving them the information and the tools to truly step up and take care of themselves and be advocates for themselves. I try to explain when people say, oh, she just massages scars. I'm like, oh. And the big thing after it too is, again, we're talking about the scars themselves. Most people who are saying that they're dealing with scars, they're not doing the rehab section of it. I can't just release a scar that's been pulling on a person's body for 10 or 15 years and then not go back and reset the body. And they're just going to stay. They're either going to go right back into their compensations that they were in, or they're going to create new compensations because the body's not quite sure what to do with the fact that they're loose now. The last thing you should do, you don't let the 3-year-old drive the car. Right? You have to explain and show and guide and help it so that it remembers what it was supposed to do, how it's supposed to work. Because the 3-year-olds are smart. They do remember. And you reset the body. That's everything that you're doing with OS. Right? And the therapist massage, oh, I'm not allowed to do that. Well, yeah, you are. And if you can't do it and you don't want to do it, that's fine. Then it's called Google. You say, go look up Tim OS, which I do. Besides me working with them, I go, there's tons of videos. He loves videos. Go look at his videos. Or I teach them how to kinesiotape themselves, right? How to use for support. And for this, I have several people with lymphatic and lymphedema issues that you can use the kinesiotape and to help with the lymphatic flow. I teach them how to do the dressing properly and what things, these are things that you can give them the power. And I'll be the biggest thing that people, when someone's injured, is that nobody takes into account the caregivers or the family members and how they can all be brought in as part of the rehab. I encourage people to bring the kids in to come in and I teach them what they can do to help. So those who can't afford to come all the time, they can still go at home, but they don't have to do it alone. It also is a huge bonding if you allow children to help the parent rehab or explain to the parent the right way to rehab the child. That's an entirely different level of healing and communication that you're establishing. And no, I did not break my scope of practice doing that. So that's a big thing that I know. I get back, well, that's not in my scope or I'm not allowed. I said, that's not true. You are allowed.
Caring for people and advocating for people's health is inside of the scope of practice.
Yes, it is.
So thank you. This has been really amazing. If someone's listening and they want to know more about the S.T.R.A.I.T method, or they just want to learn more about, maybe they have their own scars and they want to get more information or more resources, or they want to learn more about you, where can they go?
They can go to either of my sites, Marjorie Brook, and that's Brook, no E's, no S's. There's only one of me. World can't handle more than that. MarjorieBrook.com is my therapy site. Marjorie Brook Seminars is the instructional site. We will be having, you can go to Facebook. There's the Brook Seminars on Facebook and Instagram. My social media is not the hugest, but it's there. I do have a closed group that after you take classes with me, it never ends, that we go into the private group and we discuss patients and everything. We follow HIPAA rules, and people continually learn even after classes. If you're looking for to learn more about scars for as your own self, or looking for therapists in your area, you can just message me. I do have a resource on the seminar site, but not everybody is listed on that. Those who are listed are guaranteed. They've been been working with me for a long time. But I can try to find people in your area that are maybe just learning or haven't gotten to the point. I'm not one of those people who lists every single person who's ever taken a class with me on a site, because I want to find the right therapist for you. So and yeah, those are the ways to find me. You could call me.
Awesome. I will put that in the notes section of the podcast too.
You can call me.
And so you've also got a nonprofit.
Yeah, that's one of my new exciting things right now. I've been after the shutdown, I sat there and said, like everyone else, so yeah, what really makes me happy? Because the shutdown was a great thing for me because it got me to stop, sit back and assess and realize. And one of the things that I've really been wanting to do for a long time is put together a nonprofit. So that people who can't afford the therapy, because again, many times scar work is really only done by massage therapists. There are PTs, and I'm hoping eventually nurses and the rest who do it, but insurances will not cover massage therapists for this type of work, and or many of us like myself do not take insurance, and I don't want anyone to be denied. I have people who don't come simply because they can't afford it. So I wanted to put together a nonprofit where people who could get the therapy. That was part one. Part two was I wanted to get the research done to prove and educate the medical world that this work needs to be done. There is some that's out there, mostly on burn survivors, but nothing that's really gotten to the point that the medical world has turned around and said from a basic surgery that we need work. And so I wanted that research done. And I wanted to get more therapists and therapists like physical, massage, occupational, and nurses and doctors wanting to learn this work more and get more qualified therapists trained in this work. So I put together the new project was the SCAR Healing Project. We're on the process right now. We're about to we're putting in for our nonprofit status. We're getting everything together, the applications for therapists and nurses and doctors who want to apply to be trained. The first phase is we're going to be working with veterans. It'll be free clinics for the veterans, and doing research with them. And then the following year, the clinic, when the project's done, the clinic will continue once a month for free therapy for everyone who qualifies. And then the next group, either the veteran group will move on, research will go on to another state and we'll recreate the program there, or we'll start a new research project, say mastectomies or heart surgery or just prosthetics in and of itself, having prosthetics and the therapy that needs to be done there. So I'm really, really excited. It's going to take us another year or so, but it's coming along, and I'm so excited about this whole thing.
That's really awesome. I tell you what, in another year or so, when it's ready,
Mm-hmm.
do you mind coming back on the show? And we don't have to wait
Really?
a year,
No.
but
I would love to. That would be fantastic.
I would love for you to be able to share about that when
Yeah.
it's all ready and ready to go.
Well, that would be my pleasure.
Awesome. Marjorie, thank you so much for
Thank you,
being on.
Tim.
Thanks for listening, everyone. Have a great weekend.